Hi everybody, I am Dr. Banarji. I am orthopedic surgeon specialized in shoulder surgeries. My area of interest is arthroscopic surgeries, sports medicine and shoulder replacement surgeries. My area of expertise is minimally invasive surgeries and shoulder replacement surgeries. At Sakra World Hospital, we believe in giving personalized care, individualized care tailored to the individual patient's needs. If you have any shoulder related ailments, feel free to connect to our team at Sakra World Hospital for further evaluation and treatment. In reverse shoulder replacement, the surgical steps begins with incision and then preparation of the bone and then implantation. So most important thing is the exposure. Exposure generally we do it in deltopectoral approach. Deltopectoral approach starts with an anterior approach in the deltoid groove, and once we have exposed the bone, so what we do is bone cuts and then the implantation. So this is the bicipital groove. So the intramedullary entry is done about a centimeter medial and a centimeter posterior to the bicipital groove. You can use an awl or a drill to make an entry into the intramedullary groove. Once that is done, you can use an awl to enter into the intramedullary canal. So this awl you can use, and then you can sequentially enter with the smallest awl, and then you can rein the intramedullary canal and make a intramedullary entry. And once that is done, so this is the jig. It's a 135 jig. The neck shaft triangle of the humerus is 135 degrees. So this matches perfectly for the humeral neck shaft angle. So this is an extramedullary jig. So that can be loaded with the intramedullary stem, and then you can take a cut. It can be adjusted either +2 or -2, and this goes to the intramedullary reamer, and you can take a humeral head cut. This is how the jig comes, and then you can take a cut accordingly. Once you've taken the humeral head cut, this part will be removed. You can make a intramedullary broach. This will prepare for your trial stem. So when you are doing, you should make sure that your version is proper. So you generally keep the version around between 20 to 30 degrees. So this version rod should be parallel to the forearm axis. So this should be parallel to the forearm axis. Generally we keep between 20 to 30 degrees. This is for the trial stem. This generally the size will match according to the size of the osteotomy, the humeral head osteotomy. It can be the different sizes. This will match according to the size. Either it can be 2 size, 3 size, and then accordingly we can take it. So this will match into 3 size. After the osteotomy, we decide whether it is 2 size, 3 size, and accordingly we can take whichever size it matches. And once that is done, the humeral stem is prepared, and then this is the trial humeral stem. This goes inside. Once this is inside, and this is the humeral tray. So this is for the humeral component. So once the glenoid is exposed, generally there is a guided system for the glenoid. So this is a guided system for the glenoid. The glenoid can be either placed, generally it is placed about 10 degrees. This is the mark. So the glenoid is placed like this, and then the guide wire is placed into this. And once there is a guide wire which goes into that, then this is the reamer which will ream the face of the glenoid. This is a peg hole. This will make a hole into the center of the glenoid, which will make the space for the central screw. And this is where we will ream for the central screw, and the base plate will be placed over that. Then that will take 4 screws. the peripheral screws. There is a central screw and then the 4 peripheral screws. There is no trial implant for that. And after that, and this is how the glenosphere comes. This is the trial implant. So once the surgery is done, this is how it looks. So we have replaced the socket with the glenosphere or the ball, and we have replaced the humeral head with a socket. Okay, so the damaged humeral joint or the shoulder joint is replaced now, and the afunctional or non-functional shoulder will be functional. Now what happens is the rotator cuff muscles which are not functioning are not bothered now. Now the deltoid muscle will take over the function of the shoulder joint, and patient will have a functional shoulder with the deltoid muscle and the remaining muscle, and the patient will be able to do all the functions of the shoulder joint with the deltoid and the remaining muscles, and they will be able to live a pain-free life, and their elevation rotations will be restored and patient will be pain-free with the reverse shoulder replacement. So you can reach out to Sakra World Hospital for any shoulder related issues. Thank you.